the newest addition to my practice, and unfortunately, she has to relocate to Texas, but maybe just for a year.
Here's hoping.
But she's going to talk about gout, and she actually did her training in Kentucky, and then she went to the Cleveland Clinic and did her internal medicine training in residency. And then she went to the Mayo Clinic and did her fellowship in rheumatology. So she's very well qualified. So every time I see somebody from Mayo Clinic saying something, I think, I wonder if they know Sonya.
Oh. Wow, that'd be cool.
So without further ado, we're going to talk about gout.
Thank you. Thanks, Dr. Stupai. So I'm going to talk about gout today. Is it okay if I sit like this? Can you guys hear me? Hope I don't knock this down. Got a smaller group, so. So most of you guys know me, but for you both, I'm Sonya Joshi. I'm a new physician here in rheumatology. Sadly, only been here for a year and I'm leaving, but I have a lot to say about gout. So I'm going to teach you a little bit about what I know with regards to how to know if you have gout, what to do if you have gout, and where to seek help. So this is kind of what we're going to talk about today, the agenda, understanding gout basics, like what is gout, who gets gout, things like that, recognizing and diagnosing it, in yourself or in a friend or family member, and then options for treatment, and then living well with gout, like what to do with regard to lifestyle modifications if you have gout. So just briefly, what is gout? It's a type of arthritis. So arthritis is whenever you have inflammation in your joint, and there are many types. Gout is just one of the types of arthritis. It's caused by too much uric acid in your blood. So uric acid is a crystal, and that can be floating in the blood, but also deposit in joints and cause significant inflammation and pain, and that's why it causes arthritis. Why should you care about gout? It's actually extremely common. It's one of the more common inflammatory arthritides, way more common than things like rheumatoid arthritis and psoriatic arthritis, more common than all of our autoimmune arthritides that we treat here. It affects about 6% of men and 2% of women in the US. More people are developing gout due to diet changes and an aging population. Something that's not listed on here is that a lot of medications can cause gout, particularly in the heart failure space. It's very treatable. So if you have gout, somewhat dissimilarly from some of our other autoimmune inflammatory arthritides, gout is way more treatable, a lot of really good medications to manage it. And it's often mismanaged, unfortunately, because it can be extremely painful, and most people seek treatment when they have a gout flare, and there's a lot that goes into preventing gout flares that people don't know about in primary care. So we really want to educate everyone about gout because it can happen at any time. And as I mentioned, it's pretty common. Who gets gout? So I mentioned briefly about the prevalence, 6% of men and 2% of women in the US. Men get it much more commonly. Women usually get it after menopause, and that's due to the lack of estrogen. Lower estrogen levels can precipitate gout, so you don't really see it in women who are premenopausal. There are other risk factors. So if you have obesity, if you have high blood pressure, if you have diabetes, a family history of gout has been known to increase the prevalence of gout in patients. And then, as I mentioned briefly before, certain medications, particularly heart failure medications, medications that help remove fluid from around the heart, those can precipitate gout. Those are the most common. And then because uric acid is metabolized through your kidney, the organ that helps you, produce urine, that's, if you have kidney problems, you are more likely to get gout. So there are kind of two pathophysiologic mechanisms for how you get gout. So I mentioned about that crystal uric acid, which is in the blood, and that can deposit in the joints. So you either have too much uric acid or you're not able to get rid of uric acid properly. So if you have too much uric acid, that could be because of genetic factors. So sometimes in very, very young children, they have abnormal genes that produce way too much uric acid. We don't see that as commonly, but it does happen. And there are genetic diseases. One of them, the most common one, is called Lesch-Nyhan syndrome, where small children who develop too much uric acid in their blood develop a disorder where they're kind of constantly eating their fingers and peeling off their nails. It's a really debilitating disease, and it's just because of a genetic factor that affects gout metabolism. And then if your kidneys don't remove enough uric acid, that's related to usually reduced kidney function. So if you have abnormal kidney function for other reasons like diabetes or high blood pressure, it can be hard to remove the uric acid that your body naturally produces, and that can precipitate gout. And then, like I said, certain medications like heart failure medications can cause gout. A less common precipitator, but still something that happens, which can cause gout, is dehydration. So if you don't drink enough water, you don't have as optimal kidney function, and as a result, you can get a higher likelihood of developing gout. Usually dehydration in combination with other things like poor kidney function or certain medications will lead to gout. So what makes gout worse? We hear a lot about the types of food that make gout worse, but they've done a lot of studies on the different types of food that precipitate gout, like the classic stuffed red meat, shellfish, and what they realized, like the only one that really does precipitate gout is alcohol more than anything else. If you reduce your red meat intake and shellfish intake and alcohol intake overall, obviously that's going to lead to less flares of gout, but there are actually better outcomes that have been reported with just eating like a lower carbohydrate diet, healthy fruits and vegetables, and following just a generic Mediterranean diet that's a heart healthy diet, has similar outcomes. So alcohol is the main one, but the other things, avoiding purine-rich foods. So things like shellfish have a lot of purines in it. It's a protein that can precipitate gout or uric acid in your blood. Following a strict diet where you avoid all these things isn't necessary, but trying to eat a healthier diet can limit your gout flares. Medications are definitely things that can trigger gout. Like I mentioned, the water pills are medications that help reduce fluid around your heart. If you have a heart problem or heart failure, oftentimes your cardiologist may prescribe you that, and that can precipitate gout. Aspirin can precipitate gout. What does a gout attack feel like? So people who haven't had gout, they may have seen a picture of it or had a family member tell them about it. It can be exquisitely painful. It can feel like your joint is on fire. I had a patient today who I think probably has gout. She had a knee that was extremely swollen, and she attributed it to pain equivalent to labor pains. It can be really, really, really painful when poorly treated. It usually starts at night or earlier in the morning, and that's because uric acid precipitates in the peripheral joints like your feet or your toes or in a wrist or a finger whenever those joints are cooler, which is usually in the morning or the evening. It can also affect your ankles, knees, elbows, or it can really can affect anywhere, but most commonly it's in the peripheral at the extremities because those are typically cooler and uric acid likes cooler temperatures. Swelling and redness can occur, and it can look like you have an infected joint. And it can be extremely, extremely tender. So even like a slight touch to the joint, which is inflamed, can be painful. A sheet kind of brushing over the joint that's swollen can be really painful. How is it diagnosed? So the most accurate and the gold standard for diagnosis of gout is a sample of fluid from the joint that's affected. So if you think you might have gout, or a family member or a friend thinks they might have gout, they should go as soon as they can to a doctor to try and get the fluid removed from the joint that's affected, because seeing if that fluid has gout crystals is the way you diagnose gout. There are blood tests, like I said, that measure uric acid levels, but those can be inaccurate in the setting of a flare. So if you have a gout attack, your uric acid can actually be falsely low. So getting a sample of fluid from the joint that's swollen is the best way and the highest quality diagnostic test for diagnosing gout. During an attack, about like this is just another statistic, about a third of people have normal uric acid levels. Imaging that we use to diagnose gout, x-rays, normally they can be actually falsely normal whenever you first start having gout. They only show damage once you've had multiple gout attacks. You can see gout in acute stages on ultrasound. So that's the same thing that we use to like see stages of a baby growing whenever you're a mother and you're pregnant. Same thing, you use that on the joints and you can see gout crystals there in an acute setting. You can also see inflammation on an ultrasound. That's the most sensitive for acute gout, meaning gout that's happening right now. Now, if you have gout that's been going on for a couple months, you can use a type of CT scan to see gout crystals. And then, like I said, x-rays can see gout because x-rays visualize the bone, and the bone can be damaged by gout, so you can see it on x-ray as well. This is a picture of pretty severe cases of gout that are from actual patients. So the top left is kind of more of a classic presentation of gout, and then the bottom left is more severe. And you can see there's something like sticking out from that toe. That's called a tophi. It's a crystal like breaking through the skin. Whenever the joint is exquisitely swollen and tender, you can have the crystals kind of break through the skin, and it can get infected. You can see the knee. There's a sample of fluid that was removed from the knee. It can be different colors. Sometimes it can be really white. Sometimes it can be really yellow. It really varies in color. Oftentimes, if you have a lot of crystals, it can be generally more opaque. And then the x-ray on the top right shows the damage that gout causes. So there's at that big toe, you can see there are a bunch of holes. So those holes are from damage that gout has caused. So the crystals have eaten away the bone, and that's kind of what we hope to prevent. That would be a later stage finding. So you would see that on an x-ray of somebody who's had gout for maybe like 6 to 8 months, or it could be on somebody who's had gout for a couple years. But it generally tends to go to that big toe. That's a common site. Like I said, cooler areas, your toe is generally cooler than, the joints that are closer to the central part of your body. So an acute gout attack, like if you have gout right now, your finger or your toe is swollen, there are really kind of 3 ways to treat that when you have acute gout. The general presentation of gout, like I showed you in the past slide, has a lot of swelling, has a lot of inflammation. So we're using drugs to target inflammation. Whenever you have a gout flare, you're trying to bring down the number of cells that are concentrated there. You're not as focused on bringing down the uric acid level. Whenever somebody has an acute flare, you're just focused on bringing down the inflammation. So anti-inflammatory medications are the earliest form of treatment for gout. Oftentimes, it can be hard to use anti-inflammatory medications when somebody has kidney problems because anti-inflammatories like ibuprofen or Advil, naproxen, or Aleve can worsen your kidney function. So they're useful if the person has normal kidney function, but can't be used if you have abnormal kidney function. They work quickly and they can reduce pain and swelling, and they're available over the counter. So people often like to use that. Colchicine is a prescription drug, and it specifically treats gout attacks. Again, not ideal if somebody has abnormal kidney function, so it can be challenging to use this medication if you have kidney damage. And many people with gout, like I said, have kidney damage, and that's why they have gout. So also a medication that's really effective but challenging to use if you have certain health conditions underlying. It's most effective, colchicine, is when you start it within 72 hours. So the first onset of swelling or tenderness in whichever joint is affected, 72 hours after that, that's the only time you can use colchicine. Otherwise, it's not as effective. And then corticosteroids, so that's just like steroids. So prednisone, methylprednisolone, or Medrol dose packs, those are all forms of corticosteroids, and that can be used to treat a gout flare. This is what we turn to the most often whenever somebody has gout, and that's because it's safe in people who have kidney dysfunction. It's very quick in terms of treatment, and it's highly effective. Usually we use prednisone pills. We can use joint injection. Other forms of steroid are Cortrophin gel, which is a type of steroid that's given differently. You'd have to go through your physician to get that and get it approved by your insurance. But these are all highly effective ways to reduce inflammation in acute gout. And these are good options when NSAIDs or colchicine, like I said, can't be used. Do you need a long-term treatment? So the previous slide showed the short-term treatments for gout, which is like when you have a swollen and tender joint. If you only have that once in your life, you'd be hard-pressed to find somebody who would want to stay on a medication long-term. But if you keep having attacks of gout, you have to start thinking about how to prevent that. And there are different treatments that you use to prevent gout, and those are long-term treatments. The criteria for requiring long-term treatment to prevent gout is if you have frequent attacks, 2 or more per year, If you have visible crystal deposits under the skin, I showed you a picture of that earlier where somebody had like crystal breaking through their skin. If you ever have that, even if it's only one time, the likelihood of you requiring long-term treatment is pretty high because you're more than likely going to develop that type of gout again. If you have joint damage visible on x-rays, I showed you that before, that person who had kind of like bites out of their bone taken, that they would need long-term treatment to prevent further damage in other toes. Kidney stones, if you have kidney stones and they're made out of uric acid, so the most common type of kidney stone is made out of calcium oxalate, but you can also get uric acid kidney stones, and if you have that, in addition to developing gout, you will likely need long-term treatment. And then if your uric acid levels in the blood are greater than 9, so your physician or your healthcare provider will check your uric acid level regardless when you first are, when they're first thinking about gout. And if your uric acid level results above 9, you're very likely to develop multiple gout attacks without long-term treatment. So you should be placed on long-term treatment. The goal is to keep your uric acid level in the blood below 6. And with this level of control, you're less likely to get gout flares.
How do they determine uric kidney stone, uric acid kidney stone, calcium? That is just when you pass the stone. Is that the only way you can tell, or can you tell if a patient's having?
There are certain things that your physician can do, your urologist or your nephrologist, like your urinary doctor or your kidney doctor can do. There are imaging tests that can identify that. Most often when you pass a stone, they analyze it and see calcium oxalate versus uric acid, but I think you can see certain types of stones on a CT as well.
And they look different?
They do. They have different morphologies. It's so hard to tell the type. And there are other types of stones that you can get with infections as well. It's not just like, those are not the 2 types of stones and that's it. So unfortunately, more often than not, to prevent any confusion, they just analyze the stone and wait for it to be passed, because you can get like infection, like staghorn calculi. There are different types of stones that can develop from infections as well. So they would probably analyze it. That would probably be the best way. So usually when somebody has a kidney stone, their physician will let them know, oh, you had a calcium stone. More often than not, patients know. It's always good to ask if you ever develop a kidney stone, what type was it? And they'll be able to tell you. And then this is long-term medications that are commonly used to treat gout. So the first and most common medication used is allopurinol. It reduces the production of uric acid, and it's started at a low dose, usually 100 milligrams, and then it's increased gradually. The most important thing about allopurinol is that it should be increased until the patient exhibits a uric acid level less than 6. So oftentimes patients are started on this medication and then they aren't able to increase the dose, or they don't get notified to increase the dose, and then their uric acid level remains pretty high and they continue to get gout flares. And that's because the medication isn't optimized. Febuxostat is another alternative. It's used if patients have side effects to allopurinol. So certain ethnicities, African American patients and Asian American patients, can have hypersensitivity reactions to allopurinol. So oftentimes they can't take allopurinol due to genetic predisposition to being allergic to it. And then some patients who have very, very bad kidney function are unable to take allopurinol. You can start allopurinol if you have mild kidney dysfunction, but if it's very severe, generally we tend to avoid allopurinol. Febuxostat is the alternative that is used. We do have to go through your insurance and get approval before prescribing that. Oftentimes you have to fail treatment with allopurinol or have some sort of contraindication to taking the initial medication we talked about, allopurinol.
I have a question.
Sure.
Is the gout usually localized? Let's say if you have it in your foot, it's on your toe or on one of your toes, but it doesn't engulf the whole foot.
That's a really good question, and hard to say for many patients actually, but more often than not, it's in the big toe. However, whenever you have a very bad flare and it's not treated quickly or in time, it can spread to the surrounding area. So the part of your toe that's affected may move backward toward your ankle, and you may feel like the middle of your foot or the ball of your foot is affected as well. So from the outside, it could look like your entire front of your foot is swollen. However, there's usually like a foci of the uric acid. It's depositing in one area. However, because the uric acid is deposited in an area, your body reacts by having cells kind of come to that area. It recruits cells to that area and causes swelling. So the surrounding area can also get swollen. Occasionally, uric acid can deposit in the other toes, but more often than not, it's deposited in one toe and then there's swelling surrounding in multiple toes.
Is it always painful?
Yes.
So you would know you have it.
You would know you have it. Yeah, it's
Okay.
always painful. Very, very rarely, whenever patients get gout, they have minimal pain or pain that's more akin to osteoarthritis or wear and tear arthritis. This is not common. The way we would know that that's gout is by x-ray. So patients can develop something called pseudo-rheumatoid arthritis, where it's actually gout, but it looks like rheumatoid arthritis. The only way you would know that it's not rheumatoid or it's not osteoarthritis is based on the x-ray findings. It's very classic x-ray findings like I showed you. It's almost like what we call, in layman's terms, rat bite erosions that develop in the toes. It looks like a rat bit it, like bites out of the joint. That doesn't occur in other types of inflammatory arthritis. That doesn't occur in osteoarthritis or wear and tear arthritis.
So a compression garment would not cause the swelling to go down.
Correct. Good question. Yeah, it would
Yeah.
not. It would not. It's not like swelling that you get in your lower legs due to poor circulation. That's different. And that's usually less painful, hopefully. Sometimes that can feel like your legs are
It's
heavy.
tight.
Yeah, but more often than not, if you have true gout, it's very, very painful.
Mhm.
The third medication that we use to treat gout is relatively new. It's called pegloticase. The brand name is Crystexxa. This is a medication that we prescribe here at Advanced Rheumatology, and it's an IV therapy that we use for severe gout. You can only get this medication if you haven't responded to allopurinol, you haven't responded to febuxostat, usually at very high doses. And this medication is a biologic, so you get it, over the course of several weeks, and it brings down your uric acid quickly. The only caveat to this is if you do start this medication, because it's a biologic therapy, you can develop antibody resistance to it, and it can stop working. But it is effective, and if you have very bad gout, usually with crystals breaking through your skin or tophi, sometimes your a doctor will consider this medication. So an important note on starting treatment, whenever you start a medication for lowering your uric acid, and the reason we would start that is because you have high uric acid and it's causing gout flares. Anytime you start a treatment, whether you're bringing down your uric acid or you have a high uric acid, you can get a flare. So unfortunately, whenever you start a treatment for gout, you think you're doing the right thing, you're getting established with your doctor, you're starting the medication, and you bring down your uric acid because the medication starts to work, it can precipitate a gout flare, and it's kind of like a paradoxical reaction. So it can be really frustrating. There are ways to counteract that and prevent that. When you start allopurinol, for example, you usually start a small dose of prednisone with it. This will prevent you from having flares whenever the allopurinol starts to work on your body and break down the uric acid levels. Don't ever stop your medication when you have a flare. Some people will stop their medication because they're worried that the medication caused the flare. It's not something that you should do. If your doctor may prescribe colchicine or an anti-inflammatory like steroid or prednisone or ibuprofen for several months along with your allopurinol, and that's preventing the flares. Sometimes it takes 6 months to 12 months to clear all the crystals from your blood and bring your uric acid down to that goal level of less than 6. So lifestyle changes. So like I said before, I alluded to this earlier, when it comes to a specific diet you should follow, traditionally we thought, reducing all foods that contain this this compound purine, so shellfish, certain red meats, liver, for people who consume liver. We thought that reducing all purines from your diet could prevent gout flares, but more research has shown recently that just following a heart-healthy diet, like I said, the Mediterranean diet, is more effective. It's hard to kind of avoid everything which has purines in it, so really focus on just trying to increase your water intake, your fluid intake, focusing on low-fat liquids, so low-fat milk products, fat-free milk products, trying to low-fat dairy products. Those are things that will be protective against gout. The only thing that we know for sure can precipitate gout flares and make it worse is alcohol. Generally tend to avoid alcohol if you do have gout or you've been diagnosed by your physician with gout. And then with regard to red meats, limiting red meat, not cutting it out necessarily, but limiting red meat, focusing on, fish and poultry, no more than 4 to 6 ounces of red meat a day, that can help as well. Weight management, even a modest weight loss can help with uric acid lowering. And then reviewing your medications. So like I said before, a few times, patients who are on heart-healthy medications to reduce fluid around the heart, they can get gout. So if gout's really impacting your quality of life, you can't walk because your toe is swollen or you have crystals popping out of your joints, that can be really hard. So talking with your doctor about this new diagnosis of gout, the doctor who's prescribing the medication that causes gout, there might be some other alternatives that you can take. Oftentimes it's hard. Your heart's a pretty important organ, so you have to find a balance between treating the gout and also maintaining the health of your other organs. And then keeping track of your uric acid levels, following up with your physician who treats your gout. Those are ways to reduce gout flares and prevent damage in the joints like what we saw in that x-ray before. So here are a few myths about gout. Gout only affects overindulgent people or people who eat like really, crab and stuff and red meat. That's not true. Gout can affect anyone with certain risk factors. I alluded to this in the first or second slide. People who have a family history of gout, they just generally tend to get gout. It can be really frustrating because even people who eat healthy get gout. So gout is just a painful nuisance. That's not true. It is painful, but untreated gout can cause severe damage like we saw on the x-ray from before. Another myth, you should avoid all protein if you have gout. So some people believe that, you don't eat any protein if you have gout. That's not true. Certain proteins have that compound purine, which is involved in production of gout in your body, but avoiding that completely is not going to prevent gout, unfortunately. Eating a healthy and balanced diet, drinking lots of fluids, making half of the fluid that you drink water, those will be good ways to reduce uric acid in your body and thereby prevent gout flares. And then this is when to call your doctor. Sorry, I got kind of combined there, but when you should call your doctor, if you have gout, this is kind of when you should call your doctor. If you have sudden severe joint pain, particularly in your big toe, that's a common site. But as we mentioned earlier, it can happen in your wrist, your elbow, your finger. It happens anywhere. If you have fever with your joint pain, you should definitely contact your doctor because oftentimes gout can occur together or simultaneously with an infection in your joint. If you have attacks that become more frequent or more severe and they're not being controlled, and then if you have lumps developing under the skin near the joint, so sometimes you can develop kind of clusters of uric acid called tophi. I talked about that earlier, and they can break through the skin. So if you start having lumps under the skin, that's how it starts, and then it breaks through. So please contact your doctor if you start seeing something like that. And
can the lumps be anywhere?
Yeah, there are certain sites that you usually get it, like the elbow, behind the ear. Oftentimes you can get it like surrounding the knee. You can get it on the side of your toe. Usually they're in the same area where you would get a gout flare. Yep. These are questions that you should ask your doctor if you hear that you might have gout or you think you might have gout, or if somebody tells you that you have gout. You should always ask what's causing your gout because there is usually a reason for why you might have it, even if it's a family history or predilection towards it from your family member. And then it's really important that you ask if you need medication between attacks of gout. It's important to ask, what should my uric acid level be in my blood? What blood work should I look for? Kind of taking control of your own health, maybe keeping track of your uric acid along with your doctor so you know what they're looking for as well. That can be a good way for you to even help treat your own gout flares. How do you prevent future gout attacks? That will be really important to know whenever you first get diagnosed with gout. And then what dietary changes we should make. Alcohol, like I mentioned, is the biggest one, but the rest of the dietary changes, different doctors have different opinions. Following a heart-healthy diet, drinking lots of fluid, making half of the liquid that you drink every day water. Those are kind of the general principles on preventing gout flares. And then how might gout interact with my other health conditions? That's really important because gout can be pushed by the wayside if you have a heart condition or a lung condition, but gout can affect your ability to walk or your ability to open a jar or use your joints, and that can affect your quality of life as well. So talking with your other doctors about your diagnosis of gout can help increase awareness and help your doctors who are treating your other health conditions, avoid medications that trigger gout.
The shellfish, they're shrimp, lobster, crab, and
Yeah, so like I was saying, so shellfish in general, it's been thought that that really worsens gout because it has a high purine compound in it, a high content of purines. However, avoiding shellfish as a preventative thing if you don't have gout or if you're worried about getting gout, definitely not recommended. If you've enjoyed shellfish without any problems, there's no reason not to, enjoy shellfish when you can. If you have gout and you think that shellfish might be precipitating it, it might be worthwhile to talk to your doctor about it. But there have been a lot of research studies that have shown that completely avoiding shellfish or completely avoiding red meat, that's another common one that was thought to precipitate gout, doesn't lower your risk for gout. Yeah. And then finally, just remember that gout is very manageable. It can be something that you never really have to worry about again if you treat it effectively. So, make sure to remain educated if you get diagnosed with gout and talk to your doctor and follow up with them so you know what to do in terms of treatment and management and preventing the flares. So that way you don't develop damage in the joints that's irreversible.
So does it become chronic then?
Yes.
Once you've had it?
It does become chronic. If you effectively treat the gout, the way you know it's effectively treated is if you have less than 2 flares of gout per year and your uric acid level in the blood is less than 6. So if you get diagnosed with gout and then you are able to kind of say that you have less than 2 flares a year and your uric acid is less than 6, then you're effectively treated. Even though you have gout, it's not developed kind of a chronic nature in that sense.
Do you get off of medication then? Once it's lowered, how, I'm saying?
That's a good question. So if somebody's in remission for greater than 18 months, occasionally I will talk to them about, okay, maybe we should talk about whether you can come down on your allopurinol. So I mentioned this before, allopurinol is a medication that titrates all the way up to like 700 or 800. It can go up to a really high dose. When you first start, you start low and then go up until you manage your condition effectively. Whenever you've been managed effectively for several years, or even as early as 18 months, you can talk to your physician about maybe bringing that allopurinol down and just seeing how things go. Usually they'll carefully monitor your uric acid level in your blood and make sure that when you come down on the allopurinol or febuxostat or whatever medication that you're on, the uric acid doesn't go up again.
What are some of the misdiagnoses? What other diseases get misdiagnosed?
As gout, there's a disease called pseudo-gout that you can have. It behaves very similarly to gout, but it doesn't have any uric acid crystals, so you get calcium in the blood, calcium deposits.
That's how you...
And you would see on a sample of fluid that you extract from the joint, whether it's gout crystals or pseudo-gout, which is calcium pyrophosphate crystals. There are other things that cause joint swelling, like rheumatoid arthritis, infections in the joint. There's a whole host of things that can cause swelling in the joint. That's why when you first think you might have gout or your doctor says you might have gout, it's really important that they get a sample of fluid from whichever joint was affected and confirm. You usually look at the fluid sample under the microscope. Now they do that at Quest or LabCorp or wherever you send your fluid. And they look at it to confirm that they see gout crystals. And you can see them, they light up on a microscope. So it's always important to get a confirmed diagnosis that way if you can. Even if it's a really tiny sample like a droplet or 2 droplets, you can see the gout crystals with that. Other questions?
There were 2 groups when you were running down through those 3 types of medication. There were 2 groups of people that you said were less likely.
Yeah, with allopurinol, you are less likely to, there's a genetic predisposition to have an allergic reaction to allopurinol if you're of Asian American descent or African American descent. So occasionally we will do a genetic test on those patients to make sure that they're safe to take allopurinol. Yeah, good question.
I think that was excellent.
That was really very good.
Yeah, it's very thorough.
Thank you.
You're welcome. Now you guys all know how to diagnose it.